My name is Scott-Fleming, and I decided to do my presentation on acute patellar dislocations because it is an injury I am very familiar with. So what is it? A patellar dislocation is when the patella or kneecap slides out of its typical location in the cochlear groove that's at the knee joint, which is at the bottom of the femur and the top of the tibia. And it's where those two joints meet, and it slides either sometimes medially, but most often laterally away from the knee joint. So here's a short video that kind of describes what it is.
A dislocated kneecap occurs when the patella comes out of its groove at the end of the femur, coming to rest on the outside of the knee joint. A forceful dislocation can cause stretching or tearing of the medial patellofemoral ligament, resulting in chronic patellar instability. Severe tears and recurrent dislocations often require MPFL reconstruction.
So that kind of showed what it is, and then also what joints are, what ligaments and joints are involved in it, and how the reconstruction of the MPFL works. So the bones that are involved in the injury are not usually bones that are actually injured in the injury, they're just connected at this joint. So those are, as are previously described, the patella, which is the one that moves out of the cochlear groove or at the knee joint, and then the femur and tibia is kind of the two bones that join to create that knee joint. The ligaments involved in the injury, so most often it is the medial patellofemoral ligament, the MPFL, which is the ligament that can be torn or stretched during this type of dislocation. The anterior cruciate ligament can sometimes be affected in more severe cases. The patellar ligament and then the quadricep tendon are what is, the patellar ligament is below the kneecap and the quadricep tendon is above it, and those can also be somewhat stretched as they're being moved kind of out of their typical location in the anatomical position. So this is kind of what an MPFL tear looks like. And this is where the MPFL, you can see that the MPFL is on the medial side of the knee, and then it's connected to the kneecap. So some causes of the injury are almost always impact that is directly to the knee, such as falling or landing on it and forcing the kneecap out of the cochlear groove, or another kind of impact is a bad step or twist that causes the patella to move out of the groove and towards either side of the knee joint. So patella subluxation is a less severe dislocation of the patella where it moves only slightly out of the groove and not all the way laterally or medially to one side. And then this is kind of what a subluxation looks like. So on the left, it's the normal position in the anatomical position of the body. And then if it becomes only slightly displaced, so about half or a little bit more than that, is outside of the cochlear groove, but it could still probably easily be moved back in, that's probably going to be a subluxation as opposed to dislocation. So some symptoms and complications of this injury, some long-term ones can be, I'll start with initial symptoms. So initial symptoms would be intense knee pain, buckling of knee, locking of knee, bruising and swelling, and then in some cases the patella will move back on its own, but in most cases it has to be moved back by a medical professional. And then some long-term effects or complications can be instability, which can sometimes be chronic for the rest of someone's life, some deterioration of knee cartilage, which can lead to osteoarthritis in the future, and then some torn or severely stretched ligaments are going to kind of cause the ongoing presence of these initial symptoms that will probably fade over time, but they will still be present for a long time and have to be fixed, sometimes by surgery if it's very severe, like a tear, or by a combination of rest, physiotherapy, and other things. The recovery time typically is around 4 weeks for less severe cases to 12 weeks for more severe if it does not require surgery. Lots of people can return to daily activities after 6 to 8 weeks, but return to sport will probably take longer. And if an MPFL reconstruction surgery is needed because of a full tear or a partial tear, recovery can take anywhere from 6 months to 2 years before this return to activity can fully happen. And then this is sort of what a reconstructed MPFL looks like. So there's two anchors in the patella, and then one anchor in that two bands are connected to, and then one anchor in the bottom of the femur. And then finally, some physiotherapy exercises that are required, that are best for this injury. at sort of the base level is going to be your quad set and your ankle pumps, where there's not very much contraction that's actually occurring in the movement, but it's just getting some blood flow, getting the patella and the tendons more used to previous movement. And then the adductor ball squeeze, the bending at knee may vary, so depending on how far into the injury recovery time you are, how much you bend at the knee is probably going to be different. And then at a more advanced level, you're going to get into some lateral shuffling, depending on the speed and like the intensity of this will probably depend on how far into your recovery you are. A wall sit is great for this because it helps with stability in the flexion of this, and the flexion of the quadriceps muscle. And then some more complicated movements are going to be that back squat to really put pressure on the tendons in that flexed position of the quadricep. Some more complicated plyometrics or jumps that can work in multiple planes. Some lunges that will allow you to work on both the eccentric and concentric movements, and a stabilizing movement to allow you to focus your tendons and your ligaments to be able to withstand the body when it's in an isometric position. And yeah, that is all.